Well, first thing we assess is scene safety, make sure the scene is safe before we go into the house. So we just look at our surroundings to make sure everything is okay. If we think that PD is needed, then we'll call for them, and then we'll wait for them to get there, or like stage away from the house if we need to. And then once we get inside, we just go to work. We assess to make sure the patient's breathing. We go by like ABC is what we do. So airway, breathing, circulation. We just go on those steps, and whatever needs treated first is we tackle that and go from there. Definitely adrenaline kicks in. Sometimes you will see, I mean, me for instance, sometimes the adrenaline kicks in so much that you kind of like shake a little bit. But once you get the adrenaline calms you down, you're in the zone. You're so used to it, but you just have to get your mindset to be in the zone. Don't worry about anything else that's going on around you. Focus and just get it done. I really love delivering babies. I think that's my most favorite thing to do out here. I want to say 11, if I can remember correctly. 11, yes. I've also been in EMS for 16 years. Wow. So 11 is probably nothing for 16 years. I love those, and I love the calls where people are at the worst when you first get to them, and then by the time you get to the hospital, they've done a turnaround, and they're talking to you and thanking you, and they're happy, and just knowing that you've treated them and you fixed them. The better equipment we have, the easier we are able to treat everybody out here. The more education that we have, obviously, the better that we will be for the community out here around us. Donor support means that we are able to have newer, higher quality things for us to treat the patients better. And obviously, the more education we have, the better we can treat the community around us. Yeah, it definitely takes someone who is able to come to work, do their job, and somehow be able to keep it at work and not take it home with you, and just go from one call to the next, and try not to let it affect your emotions and how you're feeling, because then it affects everyone else around you. Therapy. We do a lot of therapy.
Okay.
UPMC offers, I'm not sure the exact number, I think it's like 7 free therapy sessions for us, and we can use them whenever we want. We also have a peer support team that if we were to need help while we're on shift, we just call our peer support team, and they can just talk to us over the phone, or they'll even come in for us if we need them to. I mean, body mechanics, you have to learn how to lift properly or you're going to injure yourself. But yeah, the gym is a great outlet for me. There's another girl that works here. We go to the gym together, and we go before work, and it helps. Every shift is 12 hours. 6P to 6A. But from 6 p.m. to like midnight is constant go. So I'd say the most common calls are probably lately, because it's getting nice out, are assaults, domestics, intoxications, shooting, stabbings. I am actually right now in nursing school for my RN. I have 3 semesters left. With my RN, I will automatically be a pre-hospital registered nurse because I have my paramedic already. So I can still continue to run out here on the street, or I can go into the hospital, work in there, and then what we call moonlight, just come out here whenever I want to, which is probably what I'll do because I'm going to be 40 years old, and well, you can't really retire out here. It's not very good for your body or your mental health. So it's time for me to go inside. Yeah, well, that's the thing. Like, you have to find other ways to make it less stressful. Look at the positive points of it instead of the negative points of it. I love it here. I love coming to work. I get excited to come to work. I just love to talk to people. I love being around people. I love to talk to people. If I worked daylight, I would probably honestly drive around the city and just start talking to people on the sidewalk. And, I don't know, just make their day better, you know? So a paramedic, we have a larger scope of practice, so we can start IVs, we can give medication, we can do airway things, stuff like that.